This is Stephanie Gosk. The FDA commissioner called to the White House today. Chief of Staff Mark Meadows wanted to know why vaccine authorization is taking so long, according to someone familiar with the purpose of the visit. It happened as some states are scrambling to come up with a distribution plan, while others have been working on a plan for months.
They're all over the map.
The Kaiser Family Foundation reviewed every state's interim plan in a study released 2 weeks ago.
If you had to give the states a grade at this point in the process, what would that grade be?
The grade would mostly be A for effort, but a long way to go to where they need to be.
Among the concerns, officials don't know how many doses they will get in the first phase of distribution, likely to begin later this month. Frontline healthcare workers are first in line, but less than half of the state's plans included estimates of how many there are. And state officials worry they won't get enough doses initially to vaccinate both essential workers and people at high risk as well.
We don't have enough for everyone to get it, so we will just be adjusting the distribution and the allocations to try to get as many of those high-risk people up front.
According to Kaiser, nearly every state plan will rely on federal guidance, including recommendations made by the Vaccine Advisory Board for the CDC. By the time there is wide distribution, likely in the spring, the challenge will be convincing people to get vaccinated.
I have an 8-year-old kid. I will give him this vaccine. I'll give it to my mother. I'll give it to everybody I love.
Months from now, when the effort to get the vaccine out fast becomes an effort to make sure people line up to get it. Stephanie Gosk, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.